I was just diagnosed, so my doctor and I are deciding on treatment. My doctor said there are several factors she'll use to decide what's best for me.
Let's talk about treatment decisions. First, it's so important to have your diagnostic workup and treatment planning done at a cancer center, where the team has a great deal of experience with CLL. Although at this time there's no cure, standard therapies, new therapies, and supportive care increasingly allow CLL survivors to live with good quality of life for years. There are three major goals for treatment. First, we aim to slow the growth of CLL cells. Second, we want to give patients long periods of remission, time without symptoms during which they feel well enough for normal day-to-day activities. Third, we try to prevent or at least quickly detect and treat common problems, for example, fatigue or infection. Factors used in deciding among treatment options include stage of CLL, findings from the physical exam, blood and other laboratory tests, overall health, age, personal quality of life wishes, symptoms, and comorbidities, conditions that may limit what can safely be used for treatment. There are two staging systems, Rye and Binet. Both combine findings from exams and laboratory tests to describe the extent of disease and provide clues to potential survival time. The Rye system goes from 0 to 4. A person with stage 0 CLL has the longest predicted survival time, and a person with stage 4 the shortest. The Binet system uses categories of risk. Low risk is stage A, similar to Rye stage 0, intermediate risk stage B, like Rye stage 1 or 2, and high risk stage C, similar to Rye stage 3 or 4. Visit the Leukemia and Lymphoma Society's website, www.lls.org, or call 800-955-4572 for more information about CLL stages.
Am I going to need a stem cell transplant?
Allogenic stem cell transplantation is used for some CLL patients who relapse after a good response to initial therapy, have a matched donor, and are relatively healthy. Stem cells are removed from a matched donor's blood or bone marrow, processed and preserved. The patient goes through conditioning treatment, receiving either chemotherapy, radiation therapy, or both, to eliminate any remaining disease from the blood and bone marrow and suppress the immune system to prevent rejection of transplanted stem cells.
When I learned I had CLL, I was shocked. I'd been feeling a little more tired than usual, but when my doctor ran blood tests for my annual physical and told me I had CLL, I just couldn't believe it. I panicked, thinking I might die soon. But the hematologist said there was no need for treatment right now. He said I'd be monitored, and if tests showed I needed treatment, he'd start chemotherapy. He said there are many treatment options. That's reassuring, because if one isn't what I need, we can change to another.
If a person with CLL has no symptoms, regular monitoring may be all that's needed for the time being. For people with a higher stage of CLL, treatment with chemotherapy and possibly other drugs is usually called for. Often, CLL is treated with 2, 3, even 4 chemotherapy medicines, and also a monoclonal antibody, a form of targeted therapy. A person's health and extent of disease determine which medicines are used. Sometimes age is a factor, but people of any age can be treated. There are many treatments available, and we tailor treatment plans for each patient, using medicines that work together for best results.
My chemotherapy is a pill I take daily. I'm careful about taking them, and as an extra reminder, my wife has it on her calendar to help me remember. We both know my life can depend on taking these pills exactly as prescribed. I'm so happy I don't have to drive to the clinic every week. I can stay in my pajamas if I want. My wife doesn't have to take time off work, and our lives just feel more normal.
When I was diagnosed, my doctor suggested I enroll in a clinical trial.
What's a clinical trial?
Charlie, I'm glad you asked. Sam, would you describe your experience for us?
On the clinical trial, I took a new drug, and it worked great. The study was what they call a randomized controlled trial. There were 2 different treatments. One was standard therapy, the other a new drug plus standard therapy. I was selected at random, similar to flipping a coin, to get the new drug plus standard treatment. My doctor recently told me the new drug has since been approved by the Food and Drug Administration, or FDA, which means the drug was shown to be effective. It's helped. My CLL's in remission now.
Your stories are good examples of different treatment approaches. The decisions that are made about treatment and the possibilities of being in a clinical trial have to do with the exact kind of CLL we're dealing with. And by that I mean what we know about the cell biology, including the changes in the cancer cell's genes that are specific to a person's diagnosis and the stage of the disease. There are many clinical trials in progress now, and many drug therapies and vaccines being studied. All good signs we'll continue to see new forms of treatment for CLL. We're very hopeful.
Information about CLL clinical trials is available from the National Cancer Institute, www.cancer.gov. That's 1-800-422-6237, and the Leukemia and Lymphoma Society, www.lls.org/clinical trials, 1-800-955-4572. Each has a clinical trial information service that will help you search for CLL clinical trials. The Cancer Survival Toolbox program, First Steps, also provides more information about finding clinical trials. Charlie, you're still trying to understand your illness and make decisions about treatment. Do you have questions or concerns that we can talk about tonight?
I feel funny about this, but sometimes I don't think my doctor's being straight with me. Maybe I'm not communicating well, but I think I'm not getting enough information. My daughter thinks I ought to get a second opinion, but I don't want my doctor to be offended. I don't know what to do.
It's important that you're able to talk to your doctor openly and honestly. One of the Toolbox programs focuses on communication. This could help you be more assertive about meeting your need for information, and your relationship with your doctor could improve. As for a second opinion, it's almost always a good idea, even if it turns out to be exactly the same as the first. The Toolbox's First Steps program suggests ways to go about setting up second opinions. At least you may feel more comfortable with treatment recommendations. Or it may turn out you could have a better relationship with another doctor. You and your doctor will have an ongoing relationship. It's in your best interest that you work well together.
I have another suggestion for you, Charlie. You know, a couple of weeks ago, I took part in a Leukemia Education Series telephone web education program provided by the Leukemia and Lymphoma Society. They have these and also webcasts, and you can get printed transcripts and audio recordings for an MP3 player. People all over the country were on the line, and we could ask questions of experts. I learned a lot about CLL research, the newest drugs approved by the FDA, and some information that helps me be as healthy as I can be.
What a great resource. Thanks, Renee. And thanks to everyone for your helpful comments. Please know there are people to help you through this. The people in this support group, your oncology social workers and nurses and doctors, along with other members of your cancer care team. You only have to let someone know you need help.